Welcome to Section 2 of cardiovascular anatomy. In this section, we will discuss the veins of the upper part of the body, including the head, neck, and upper limbs. The upper body veins you need to know for step 1 are pretty straightforward. You basically need to be familiar with the major branches of the brachiocephalic veins and the superior vena cava, or the SVC. The superior vena cava is labeled right here, and the subclavian veins you can see labeled here. Now I want to turn your attention to the internal jugular veins. This figure gives another perspective and was introduced in the neurology physiology chapter when discussing the dural venous sinuses. Right now, I want to draw your attention to the internal jugular veins, which you can see right here. Notice how the internal jugular vein drains blood throughout the entire brain. All of the deoxygenated blood throughout the brain here will ultimately drain through the internal jugular veins. Next, look at this image. This figure was introduced in the neurology physiology chapter when discussing the foramina of the skull. This is an aerial view looking down into the base of the skull. Right now, I want to draw your attention to the jugular foramen, which you can see right here. And it is through these jugular foramina that the internal jugular veins exit the skull. Going back to this image, notice that as the internal jugular vein travels down, they combine with the subclavian veins, forming the brachiocephalic veins. So in summary, the internal jugular veins drain the brain. Now let's focus on the external jugular veins. The external jugular veins drain the face and neck into the subclavian vein. In this way, the jugular veins are analogous to the carotid arteries discussed in section 1. Recall that the internal carotid artery supplies the brain, while the external carotid arteries supply the head, neck, and face. So whether you're talking about the carotid arteries or the jugular veins, the internals supply the brain and the externals supply the face and neck. Going back to our table, the brachiocephalic veins receive blood from the internal jugular vein and the subclavian veins. Also, the external jugular vein drains into the subclavian, which then of course enters the brachiocephalic vein. And the external jugular vein drains the face and neck, while the internal jugular vein drains the brain. Something to be aware of is what will happen if the brachiocephalic vein becomes obstructed. Obstruction of the brachiocephalic vein can be caused by many things, including cancer, thrombosis, or anything that decreases venous drainage throughout the brachiocephalic vein. You can imagine that if there is obstruction here, then blood will accumulate and congest upstream vessels, such as the external jugular vein and the subclavian vein. It is reasonable to assume that there will be symptoms from increased internal jugular vein pressure. However, patients typically experience congestive symptoms from the external jugular vein and the subclavian vein. Now, what do you think these symptoms would be? Well, we know that the external jugular vein drains the face and neck. If you can't drain these areas, blood will accumulate, so the patient will likely have swelling and edema of the face and neck. The same idea is true for the subclavian vein, which drains the arm. Blockage of the subclavian vein would lead to upstream swelling and edema of the arm. So if you obstruct the brachiocephalic veins, you will get unilateral swelling of the tissues drained by the external jugular vein, so the face and neck, and the subclavian vein, which is the arm. But now let's talk about bilateral swelling with SVC obstruction, or SVC syndrome. The SVC, again, is seen right here, and it receives blood from the brachiocephalic veins, as we already discussed. If obstructed, like right here, we will get congestion of the external jugular vein on both sides, as well as the subclavian veins on both sides. This would lead to edema and swelling bilaterally. The fact that bilateral swelling occurs with SVC obstruction, while unilateral swelling occurs with brachiocephalic vein obstruction, is very testable and very high yield. So let's do a question to reinforce this material. A 73-year-old woman with a 43 pack year history presents with coughing accompanied by bloody sputum for 3 months. A chest radiograph is obtained, indicating likely lung cancer. Physical exam reveals noticeable neck distension, a ruddy appearance, and edematous hands. If the physical exam findings are caused by the mass seen on the radiograph, what vessel is directly involved? A, the right brachiocephalic vein. B, the superior vena cava. C, the left brachiocephalic vein. D, the right external jugular vein. Or E, the left subclavian vein. Hopefully you notice that the question states that the hands, plural, are edematous. This should make you think of bilateral swelling. So which vein must be obstructed to cause bilateral swelling? The SVC, which is choice B. Based on the physical exam, we know that the right brachiocephalic vein, the left brachiocephalic vein, the right external jugular vein, and the left subclavian vein are all obstructed. However, they are not directly obstructed. So all of these choices are incorrect. And that concludes this section.